Colon cancer means that there is a tumor in the colon, and cancer refers to disordered cell growth. So these cancers can grow very rapidly and then spread to other parts of the body and lead to death of the person. In this case of colon cancer, it usually develops in a benign tumor, which is called a polyp, that grows there first, and it may take 10 to 25 years for a colon cancer to develop about 85% of the time. In the other 15% of the cases, colon cancer may develop in as little as 5 years from a polyp.
Well, everybody's at risk. We know that colon cancer incidences increase with age. So statistics have shown that over the age of 50, the chance of getting colon cancer is much, much higher. We now know that family history probably plays a more important role than even diet and lifestyle factors. If you have a first-degree family member with colon cancer or colon polyps, for example, your father, your mother, your brothers, sisters, or a child with colon cancer, your risk of developing colon cancer is multifold that of somebody without a family history.
Lancaster General is promoting colorectal cancer screening because colon and rectal cancer is a problem all across the United States. It's the third leading cause of cancer death in both men and women. In Lancaster County, we're seeing a higher mortality rate here than in other counties in the state. And for that reason, there's been a special emphasis to get people in and get them screened. We think we can probably prevent 70% of the cases of colon and rectal cancer if people have screening with an appropriate procedure and have polyps removed before cancer develops in them. There is a higher incidence of colorectal cancer in Lancaster County and a higher mortality rate compared with other counties in the state. In 2007, there were 200 cases taken care of here at Lancaster General Hospital.
Steps for preventing colon cancer are, number one, to live a healthy lifestyle. That includes diet. We usually recommend high vegetable, high fruits, high fiber diet, which would include at least 5 servings of fruits and vegetables. And then, of course, controlling your weight is one important step. And that includes eating reasonable amount of calories and then increasing your exercise. We should do exercise about 30 to 45 minutes, about 4 to 5 times a week on the average.
Colon cancer screening is probably the most effective preventative tool for any cancer because we have such a long time to intervene before you actually develop a cancer. And colon cancer the incidence of colon cancer has been decreasing in the United States since about 1995. And that is at least in part because we are screening for it and removing polyps in the rectum and the colon before they become cancer.
Colon cancer is one of these insidious cancers that oftentimes early on does not give you any symptoms. The majority of people with colon cancer will not have any symptoms until it is very late in the stage. The key to curing colon cancer is to diagnose it early. But if we can even perform colonoscopy and catch colon cancer at an earlier stage, while it is still contained within the colon itself and hasn't spread beyond the colon, then the patient may be cured.
Colon and rectal cancer can cause symptoms, but a lot of people are diagnosed with colon and rectal cancer before they get any symptoms. Symptoms that could occur include abdominal pain, rectal bleeding, or just a change in how you normally have bowel movements.
Usually when we perform colonoscopy, it is done in a very private manner, and it is certainly a procedure that can potentially save your life. So do not let embarrassment lead to a life-threatening condition. But it is a very convenient and safe procedure, and it is highly recommended for everyone over the age of 50 for prevention of colon cancer. Colon cancer is one of the most preventable cancers in the United States, and there is really no reason why anybody should suffer from colon cancer.
As a matter of fact, it does appear that diabetes and overweight are risk factors for colon cancer as well. So right now, the basic recommendations are to do those common sense things that we always recommend. A healthy diet that's rich in fiber, low in fats and cholesterol, and a regular exercise program might be preventative for colon cancer. Some experts may recommend high intake of folate and calcium as well.
Screening depends on the individual. If you're at an average risk, in other words, you don't have a family history of colon cancer or any other condition that predisposes you to colon cancer, then you only have to be screened once every 10 years. We find polyps, and it depends on the size and the number of polyps. Your screening may need to be done more often.